Good afternoon, everybody. It's Friday, which means all things advocacy with AARP North Dakota. I'm Josh Askvig, State Director for AARP North Dakota. With me is Janelle Moos, our Advocacy Director. Janelle, exhale.
Right?
Right?
Are my shoulders down away from my ears now? Do I look a little bit more calm, a little bit more present?
Absolutely. So, Janelle, it's been, for those of you who are tuning in or just getting online and starting to tune in, it's been a couple of weeks. I know we took last week off. We did that because it was a little unclear when they were going to adjourn and be done with the 67th regular legislative assembly session. We'll talk a little bit more about that here in just a second. But in short, the legislative session has wrapped up. Janelle, we're going to spend a couple of minutes here talking through what our priorities were and what happened as part of the session. But before, maybe just kind of sum up what happened last week, how it all ended, what went down.
You know, the legislature had planned to save a few days, both for redistricting as well as looking at some other federal funding that's coming forward later on this summer. And they were successful in doing that. Last week was, wrapping up really significant budget bills, including the Department of Human Services budget, as well as, some other policy issues they were trying to negotiate between the Senate and the House. But ultimately, they gavelled out late Thursday evening. It was after midnight. So they were able to maintain 4 legislative days that they'll be able to use during this year to help finish up some business that might come forward in the coming months.
Excellent. And Janelle, I know you were busy watching it till very late, and thanks to your work and to our volunteers. So heading into the session, if I remember correctly, or remind our viewers, we kind of had 3 buckets or 3 areas of priority. So let's just start there and remind folks heading into the session what our members and volunteers wanted to work on and what we were aiming to accomplish.
Yeah, you're right. So early in December and then coming into January, we identified 3 priorities, or as you said, buckets for our work during the legislative session. The number one was fighting to help lower prescription drug costs. That was our number one priority this legislative session. The other thing we hear a lot from our members and older North Dakotans is, how can I stay in my community longer? So our second bucket was really making sure to provide not only access to home and community-based services, but also healthcare coverage, making sure your needs were met where you wanted them to be, in your home, in your community. And then the third one, which we talk a lot about, is about how do we prevent fraud? How do we make sure that older North Dakotans aren't victims of both financial exploitation and other scams and frauds that come up? And we've seen a lot of that, especially during COVID. A lot of new scams have been popping up. So what are preventative and proactive things that we can do to protect older North Dakotans?
And as an aside, and I'll put it in the post here, for those of you interested in learning more about how you can protect yourself and your family, we're going to have a lunch and learn on fraud next Thursday. And I'll put the link on where you can find that and register for more. So sorry, you just mentioned that, and I thought it'd be a good chance to tell folks about that coming up next week as well, with the Attorney General's office and the state North Dakota Securities Department. So Janelle, let's 3 buckets. Let's start with lowering prescription drug costs. As you said, this was priority 1 for us and our members. And I want to, before you talk about what we saw happen this session, I first of all want to thank our members. When we said we needed you to reach out and speak up, you did so repeatedly. And I think some of the results that Janelle's going to share bear that out. So Janelle, tell us what happened in the prescription drug space and what's going to be changing in North Dakota due to some of our work.
You're right. I think our members' voices were heard loud and clear during this legislative session. I think what was compelling was, we know that 40% of older North Dakotans don't fill their prescription drugs because of the cost, and we know that there's widespread support for looking at policy solutions, and legislators heard you. And what we're excited to talk about is that 2 different pieces of legislation were passed this legislative session, and one has to do with prescription drug cost transparency. So a lot of you have questions about, why is my prescription drug so costly? Why does it potentially change month to month or year to year. So what this bill will do, or what this law will do starting August 1st, it makes drug makers, they're going to be required to report those increases. They'll talk about how the drug is priced and justify if they have to increase the drug by 10% in a year. They have to explain why, or over 5 years, if there's a 40% increase, it really starts to take the, you know, not the secrecy, but really taking down the mystery about why are drug prices so high, what goes into the cost of those prices. This law is significant in starting to create some transparency around this drug market and allowing consumers to know and understand what goes into the pricing, and so they can make some good decisions with their doctors about what drugs they want to be on or need to be on, and is there a less costly drug out there for them.
And part of what that bill will do is also inform the second win, the second piece of legislation. You want to talk about the study?
Yeah, absolutely. I think the data that we will get from that transparency law that will go into effect will help shed some light on a very comprehensive study that will be a mandatory study during the interim. And they'll study, importation programs. They'll study reference pricing, pharmacy benefit managers. So they're really digging in. Legislators knew they wanted to do something, but they knew they could do more. But they want more time to study what other states have been doing, what solutions could have a big impact on consumers, who they were ultimately concerned about. They didn't want to pass legislation that they didn't see would, at the end of the day, impact pocketbooks. And so they'll give themselves some time to study and dig into other solutions into the next couple of years.
Excellent. So obviously some huge wins in the prescription drug space and some good progress for 50 plus North Dakotans in prescription drugs. Let's move on to the next one about providing access to health coverage and home-based services for folks needing long-term care. Let's talk a little bit about what happened there. And there were some wins in that section, or some progress in that section as well.
I would definitely say there was progress. I think what we heard, not only from legislators, but families, and was that they were concerned about how their loved one, their mom, their sister, their aunt, how can we stay and keep them safe in their community longer? So there was a conversation. Not only, most of it does happen obviously in the Department of Human Services budget, but there were conversations and other policy bills about there's a movement about how can we make sure that if someone wants to stay in their home, they have the ability to do that and the funding to do that. They have services in their home. Someone can come in their home and provide that service. We did see some increased funding for rental assistance. So if you have to transition back home or want to transition back home after receiving care, there's some additional funding there. There's additional funding for food assistance. So most of where you see those little changes is in the Department of Human Services budget. But I think there is going to be movement over the next couple of years about how do we have conversations in rural communities, in communities with nursing homes. How can they look at a different way of providing the service? So maybe it's not actually in the nursing home, but maybe their staff looks at how can we go out into the community and provide that level of care, or a certain level of care in someone's home. So this is really just the start of a more longer term discussion about re-envisioning what care looks like. And if you want to stay home, how do we make sure that communities have both the resources and the staff in order to do that?
Yeah, absolutely. And for those of you who've heard us speak prior or read our stuff prior about our work on family caregiver supports, obviously that's a part of this as well, and whatnot. So encourage you to continue to reach out. And again, another plug, neither of these were intended, but another plug is coming up at the end of this month. I think on the 27th, there's a webinar on family caregiver supports and resources. Again, you can find that at the same link that I just posted, arp.org/ND events, to do that. Janelle, last but certainly not least, we were looking at how we can prevent and combat financial exploitation, abuse, neglect, scams, and fraud of older and vulnerable North Dakotans. We had a big win in that bucket as well. So you want to talk about that?
Absolutely. You know, the Attorney General's office is a partner with us. They really help to get us good information out there for consumers about how to prevent fraud or becoming a victim of fraud or theft. And there was a bill that was passed and will become law, you know, in August as well. But it's really looking at how to increase protections for vulnerable North Dakotans. We've seen a big increase and an uptick in scams and thefts related to COVID vaccines and other things, but we've started to see other scams start to trickle back up. So what this does is allow for really enhanced attorney general protection. So making sure that if you are a victim of theft or fraud, that there are protections there for you, but also kind of flipping it and making sure that we find other ways to prevent and get more really valuable information out there for consumers.
Absolutely. I think it was great, and we appreciated working with the Attorney General's office, and we're excited to have them again next week for the education event as well. So, Janelle, we had wins in all three of our big areas. I mean, we set out to accomplish and improve the lives and public policy for 50 plus North Dakotans around prescription drugs, providing access to health coverage and home and community-based services, and preventing financial exploitation. All three of them saw some progress and improvement. For those who think that's all we did this session, there were numerous other bills, too numerous to get into, but maybe one or two other items, Janelle, that we spent some time on that you think would be important for folks to know a little bit about.
You know, as everyone knows, we've done a lot of work to make sure that families can stay connected during this past year with the COVID-19. And looking at nursing homes, it was a really critical time for nursing homes to keep residents safe, to keep staff safe. But what we heard loud and clear was that families missed seeing their loved ones. And so even though we had advocated and continue to advocate for, if you can't be there in person, how can we make sure that you have a virtual, you know, ability to see and talk with your loved one? But there was a bill that passed that designates a caregiver. So even in times of an emergency, every resident will have you know, access to and make sure they have a designated caregiver that can come into the facility, making sure that they have the proper equipment and training to come in an emergency, so that no one is left really with no one by their side in the nursing homes. And this was something the legislature really felt was important, not only during emergency times, but making sure that even in non-emergencies, that there's a designated caregiver there in the facility for someone living in a nursing home.
Awesome. And anything else? I think there was a seatbelt law that we worked on.
There was a seatbelt law, and it was so close. You know, this is something that you have been part of a statewide working group, and there's been a lot of critical conversations that have happened, not just this legislative session, but others. We were just a few votes shy this session from getting a primary seatbelt law. We know that with our driver safety program, that we want to make sure that folks are safe on the road, and seatbelts is a key component to that. And it's a statewide group. They've made significant progress. Unfortunately, they were just a couple votes shy of getting that passed in the House. But I know there's more work to be done, but it's an important you know, bill that we supported, and hope the conversation will continue during the interim. So.
Yeah, and a big shout out to our volunteers and friends at the North Dakota AARP driver safety program. They do wonderful work, and I know they're looking forward to eventually getting back to doing classes in person. Janelle, let's pivot just briefly. In addition to the legislative session, while all of that was going on, we were also doing work outside of the legislative session. And as folks may know, our advocacy is not just legislative related. We get involved in many things. One of those is a pocketbook issue to many North Dakotans around utility prices. And so we just recently had a bit of a win on a utility case. Do you want to just quickly update folks on that?
You know, you're right. Pocketbook issues are something that we want to make sure that don't just show up in the legislative session, but we were working to push back on what would be a pretty significant increase. MDU had wanted a rate increase. We had intervened in that case. Ultimately, what we can tell you is that although your rates are going to be increasing, we saved consumers over $1 million by being involved in this critical case, making sure that consumer voices are heard to say, in a pandemic or not a pandemic, some folks on fixed incomes, little increases in utilities can really put a pinch on their pocketbooks, and they have to make critical decisions about, gosh, is it my utility bill this month, or is it my rent, or is it my grocery bill? And so we're there to make sure that vulnerable older North Dakotans say, hey, this is too much. We can't keep continuing to have these rate increases. It's going to have a long-term impact and really push folks, at that level of income, that it's just too much.
Absolutely, and I think the critical component of that is some recognition by the members of the Public Service Commission about what is happening to residential consumers. And so I think that was important. For those of you who may not be MDU natural gas customers, but maybe you're an Excel electric customer, we've also intervened in a case that'll be heard later on this year. So there's more to come on that as well. And maybe that's a good pivot, Janelle. Advocacy doesn't just happen during the legislative session. It happens in between as well, and fairly constantly. So how can folks tune in? Where can folks learn more? And what's kind of the next steps for folks who want to stay engaged?
What we know is that one of our prescription drug bills will be studied, but the legislative management will be meeting in a couple of weeks, and they'll identify other studies that they'll be looking at considering during the interim. There are several issues that I think, might not have fit into one of our three buckets, but are still important for us to watch. And so stay tuned. You can watch that legislative management meeting on May 19th online. But you can also, we hope to do these weekly, we're going to move these to monthly. So you can still catch us once a month, starting in the summer, to catch up on everything advocacy related. But we're always going to make sure you have the information at your fingertips. On the bottom of your screen, you can see we put our updates at aarp.org/NDA team. And so you can find a more comprehensive report of this legislative session on the page today, and then look for other reports related to both statewide, federal advocacy work. We're hoping to get involved in local communities as well. So if you have issues that are important to you in your local community, reach out to us, and we want to make sure that AARP doesn't just show up at the legislative session, that we're in your home community, that we're at the federal level, making sure your voices are heard.
Yeah, and our job is really about empowering you as a consumer and as an older North Dakotan to help impact public policy to benefit 50+ North Dakotans. So again, while you won't see us quite as frequently, we'll still be coming to you once a month, and maybe infrequently if there's certain circumstances otherwise as well. But I really encourage you, if you have any interest, visit aarp.org/NDA team and join the A team, or at a minimum, learn more. It's a great group of folks. I'm thinking about Ellen and George and Mern and some of those folks that we talk to regularly. Now that I've named a couple, I'm forgetting a few others, and so apologies.
Mike and Marilyn and
thank you.
Lorraine. I mean, there's so many voices, and they were really, really critical on so many levels during the session. So
absolutely,
if you want to join, we're always got more room at the table. So.
Well, kudos to all of you. Kudos to you, Janelle. I think all in all, a successful legislative session for 50+ North Dakotans. Still a ton of work to do. We'll be back in touch. Anything else you want to leave with folks, Janelle?
No, thanks again. It's been great spending every week with all of you in the afternoon, but look for monthly updates, and don't hesitate to reach out if you need something or have some ideas. We'd love to hear from you. So.
Absolutely. Well, this has been another All Things Advocacy with AARP North Dakota. Have a great weekend, everybody.